So are you ready to make available some of this molecule to the consortium, to the academic consortium?
So the answer to that is yes. So what we want to do is, obviously we have a lot of molecules in the fridge that may not be drugs, but have the right pharmacological properties. And that was discussed in the EFPIA consortium, and this is something that we want to make available, at least some, maybe not all, but critical ones. We want to look at this by case, obviously, but this is what we're saying. So in order to advance this field, this is something that we should do.
Hi. Oops, sorry. I have a practical question. Maybe it's not very specific, but I think that it is appropriate for the autism issue. I think that most of us that are doing this type of research have ongoing collaboration and projects with the US for the reason that you pointed out in your presentation, that the situation there is a bit different. There are things that are possible there, and in Europe we are still developing. So in the context of an IMI project, how do you acknowledge the fact that we might look at what is done in the US or pursuing this similar strategies within Europe? Because probably within 5 years, I don't know, diagnostic criteria will change and we will have new inputs from overseas. So how are we expected to deal with that?
Well, the answer to that is that it has to be looked at case by case. So some procedures that work really well elsewhere, and I think US is leading this field, I think very much. That's why we're also very happy that somebody like Rob has joined the team. But we also have to just judge the mechanisms that are in place in the US. We have to assess ourselves. You know, does it make sense in Europe? There are cultural differences, but there may also be other differences. So not everything necessarily that works in the US works in Europe. So this is a case-by-case case, and we need to look at this in depth.
There is a question up there. Oh, okay.
Just far, I think the overview covers very comprehensively the procedures in relation towards target selection, target validation, biological lead optimization, proof of concept and proof of principle studies, and then the dissemination of that information. One thing that struck me, though, I think, as you're undoubtedly aware, the relationship between the medicinal chemist and the pharmacologist is one of the key relationships in drug discovery. Is there also a space for chemical optimization of molecules that might be potentially interesting for autism within this call?
No. So this would be in the competitive space, I feel. Maybe Elisabetta would comment, but this is not what we want to do in the context of IMI.
So if I may just comment about the question related to the US. And certainly, as our FPI colleagues, it's clear that the US have, developed a number of excellent centers and have a number of very attractive approaches. I would, however, and we will ask our evaluator to check that we are not just duplicating what's done elsewhere. So we are not there just to, copy what's done in the US, so just to offer the industry in Europe what they have already in the US. What you should really look at is seeing which are our strengths, because we are convinced that we have specific strengths in Europe, so that we can complement also in a clever manner what is done in the US. So, and these are, again, questions that we will ask to our independent evaluators, and some of them will certainly be outside Europe, probably from the US. But we have close contacts with US organizations, so we are trying to join forces between public-private partnerships. So I think it's very important to understand that we have an European dimension, we have a global goal, the companies are global, but for us this is European money, so try to build upon your strengths. And I'm convinced, we are convinced that Europe might have some, you know, cutting edge and some really very good, perhaps niches in which Europe is competitive, or perhaps even is ahead of the US. So think about this, because this might be very important to get your proposal successful.
One question that I also have is how to find out which consortia are going to be formed. That was also discussed in the previous workshop. We are an SME, and apparently we have to find a leading academic partner who wants to chair or to pull the consortium together, who will be leading that consortium. How do I figure out who are, say, intending this? I can just stand up and express my interest in, say, developing new technology for human behavior, and hope that someone here will hear that and come to me during the drinks afterwards and say, well, do you want to join our consortium? Or is there a more structured manner that you have in mind?
Well, as I show in one of my slides, we have a partnering tool where I strongly recommend that you register inside.
I did that, but then you can hope to be discovered. But it doesn't tell you who are, say, the initiators among the academic groups. So we SMEs then take a sort of passive role. We sort of advertise our capabilities, and we hope that the leading academics will find us. But is that
I mean, the point
that's
is
not the most proactive way of matchmaking, I think.
No, I mean, there you can also see who is registered there. You can see what are experts in the area that have also registered. You can make a search for academic search, and maybe also proactively try to contact with people and ask if they are involved and they are thinking to, because if they have registered in the tool, means that they are interested specifically in this topic, so you have a good chance that they are starting making a consortium, and then you can proactively contact them and try to say, hey, I'm interested to be involved. So that would be a way.
Okay. We could, of course, also do it, say, in this meeting here, and just ask
Absolutely.
around, are there any academic initiators in this room? Oh, okay. No, because that's faster, I think, than sending
That's one of the aim of this.
200 individual emails to all the people who are registered in the partner tool, right? Okay.
I have a practical question. Clearly, the transgenic animals will play an important role in a consortium. How should I read the contribution of the FPI? If it says Johnson & Johnson will generate transgenic animals, is it still important to have my own group?
So Johnson & Johnson is leading that work package, right? So they're not providing the transgenic lines, all of them. So they may have some transgenic lines, and we have discussed that at the face-to-face meeting, that we will share that, and we're looking at the provider, and this could be anyone. We talked about Jackson Labs or Charles River, but this is something that we need to set up, and obviously this is going to be critical for the success of work package 2. So your question is valid. I can't answer it yet, but we're looking into that.
But you could also say, okay, if you come up with a group who's handy in making transgenic animals, that would help for your consortium.
Excuse me?
Well, if you add to your own consortium a group that's very handy in creating transgenic animals.
Well, that would be a very interesting proposal.
Okay, clear.
Any more questions? Okay, then if we are finished, I would like to thank you everybody for participating. I think this is a very challenging topic, and I really hope that we will receive a good expression of interest. And please, if you have any more questions, please just contact us. I mean, also, again, I mean, for this, trying to find a partner, of course, if we receive mail from different partners, we can always, I mean, make and try to help people to contact each other.